Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about range of motion and trying to gain and restore range of motion if you're 3 months or more out from having knee replacement surgery. Before we jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, rehab and recovery, exercises, and much more. So in previous videos, I've talked about kind of that window of opportunity early on after knee replacement surgery. And we talked about how the most improvements and the best gains and the fastest gains and improvements in your range of motion and your flexibility are really going to come in that early phase after surgery. Those first 6, 8, maybe even up to 12 weeks after surgery is when your body is able to really maximize the range of motion. During those first few weeks and as you start to progress beyond that phase, now your body's starting to go into that third stage of healing and recovery, and that means laying down and organizing collagen, connective tissue, scar tissue. And as the body goes through this healing phase, which lasts for a very long time, it can last up to 2 years after surgery, the more and more that tissue lays down and that new connective tissue forms, the more and more you're going to have to be patient when it comes to restoring any type of range of motion or flexibility. But an important message, an important thing I want to convey is that it's still very possible to improve and gain range of motion even if you're 3 months out from surgery or even longer than that out from having surgery. The key is that it's going to be slower, it's going to take a lot more time, it's going to take a lot more effort. So let's talk about some of the important keys to continuing to make improvements in your range of motion at your knee or just general flexibility when you're 3 months or more out from having surgery. So like I just said, it's going to take time. It's going to take a longer time to see improvements. The improvements are going to be much more subtle. And the key to get this is a lot of consistency of doing certain stretches. So spending time under tension, I call it. So getting into a position where you have your knee bent if you're working on flexion, or you have your knee straightened if you're working on extension. And you're just trying to hold that position for a matter of minutes, as much as you can tolerate, and applying that load, applying that intensity to help to make those slow changes to the tissue, to your range of motion over time. I talk a lot about that inverted U, where we talk about if you stress the body and you stress the tissues too much, it can cause pain, it can cause kind of a flare-up of symptoms, and it's just not tolerable and enjoyable. If you don't stress the body enough and stress the tissues enough, you're not going to see any improvements or see any benefits from it. So we need to find that happy medium, that middle part, where we're stressing those tissues, trying to make changes long term, but then not stressing the tissues too much to cause pain and discomfort and a flare-up of symptoms. And that's going to be key throughout the process. So again, lots of repetitions, lots of time under tension, lots of time spent in those positions of knee bend maximally, knee extension or straightening as much as you can and holding it. And then just being consistent. So doing this ideally every day or multiple days every week. And just staying on top of it and staying consistent to start to slowly see those improvements over time. And the thing is, you'll probably have episodes where you're kind of at a plateau and you're not seeing much change or much improvement. And I encourage you to work through that plateau. You may not see those changes in the measurements, in what it looks like, and how much range of motion you're getting, but those characteristics and those changes are still occurring at that tissue level. Tissue changes to the structure of the muscles, the tendons, the ligaments, the joint are very slow and not recognizable and not necessarily noticeable to the naked eye. So work through those plateaus as well is very important. And then I would just say make sure you're incorporating some rest. It's a marathon, not a sprint. I don't know how many times I've said that in these videos. So patience, time, consistency, and your work and your efforts will pay off in the long run. So hopefully that gives you some helpful insights, some helpful framework to consider when trying to improve your range of motion, improve your flexibility if you're 3 months or longer out from having knee replacement surgery. Again, it's very possible, and it's absolutely possible to see those improvements, but it's just going to take a lot more time and consistency. I hope you found this insightful. Be sure to hit that like button and leave your comments and questions below. Again, be sure to subscribe and turn on those notifications if you're interested in catching many more videos just like this. Thank you.